Thank you everyone for staying late. I know we're slightly over time here, but we'll finish out with a focus on the treatments, and we have many great panelists here. So we'll have maybe each person want to introduce themselves, and just you could maybe mention a little bit about what treatment you're on. Do you want to start?
Is it on? Okay. I'm Melody Kraft. I am from Meridian, Mississippi. I was diagnosed with MOGAD in December of 2022, and I'm on tocilizumab. Yeah.
Perfect. Okay. You can pass the mic maybe across to.
Hi, Pam Ricken from St. Louis Park, Minnesota, and I was diagnosed in March of 2023, and I'm in a trial.
Mr. Harder?
I'm Jamie Harder from Waseca, Minnesota. I was diagnosed in February of 2022. Still going through treatment in Mankato. I can't remember what it's called.
Okay, I think tocilizumab or the Actemra medication is the one you were on. Yeah.
Yep.
Okay, Mr. Ryan.
Hi, I'm Tim Van Roy. I'm from Shoreview, Minnesota. I was diagnosed with MOG in 2023. Oh, and can we talk about which drug we're on?
I think you're going to say if you're in the trial.
I'm in the trial.
I'm Jennifer Stewart, and I was diagnosed with MOG in January 2023, and I currently do IVIG.
I'm Brody Kalk. I was diagnosed with MOG in 2021, and I'm on IVIG and rituximab.
Okay, great. So a broad range of different treatments here, and thanks for all sharing your experience. Maybe I'll start with Ms. Kraft. So what were the factors that were important to you in deciding on the treatments, and did they align with the doctor, or how did you feel we came up with that decision?
So I, about 8 months after I was diagnosed, I became a patient at the Mayo Clinic here. And my husband and I came and stayed about 2.5 weeks, went through a variety of tests set up by Dr. Flanagan and Dr. Chin. And then once all the testing was done, I felt like as a patient, this was the first time that I was really heard and seen by a doctor. We actually called my parents. I don't even know if you remember that. We called my parents on speakerphone, and Dr. Flanagan spent about 2 hours going through some information about different treatments that he thought would be the best, and sent us home with the information back to the hotel. My husband and I read over it for about 2 days, and then when we came back in, the decision was made. We felt really comfortable with the decision of going with Actemra. That was what Dr. Flanagan kind of thought would be the best for us. Located in Mississippi, we were not, I wasn't a candidate for one of the trials because of location. And so just that deep discussion of this is everything. He had reviewed my case thoroughly. I felt extremely comfortable that he knew me as Melody and everything that I had gone through personally. And so we felt great with his recommendation, and I've done extremely well. I have not relapsed since I started that medication. Yep.
Great, yeah, and I think it brings up the nice point of sometimes it's location from the facility, and there are many factors that come into it, and some of the medications are available in two forms. You know, the tocilizumab is available both as an injection under the skin and as an infusion, and sometimes we make those decisions based on, in partnership with the patients, based on preference and different aspects. So I think it's very important to partner with the patient.
It is. It's like I wasn't going to really be, I can't, with a family. I have a young son at the time. My husband was teaching. There were a lot of factors that went into having access to being a part of the trial. But they're, working with Genentech and their patient foundation, that really secured that I was going to be able to get the medication that I needed. And Actemra has worked out perfectly for me.
Okay. And what about Ms. Stewart? Any barriers you had to getting on the medication? Because MOGAD, as we've all heard today, lacks any FDA-approved medication. So a lot of times there's arguments with insurance companies, or sometimes that has to dictate our choices. So
Absolutely. Pretty much from the beginning, I had many, many attacks in a short amount of time. And so I was originally put on Plex as like a maintenance to get me to IVIG until it could get approved. Actually, I was on Plex 4 full months waiting for insurance approval for IVIG. The reason that we went with IVIG for me and not a trial, because I would have been more than happy to have been on a trial, is I have an anaphylactic contrast allergy. So it makes it where I can't be imaged with contrast. So that kind of nixes me from the trial. But since being on IVIG, starting in August of 2023, I have been relapse free. So that's been really nice.
Great, and excellent to hear that experience. And certainly there are factors. Some people are claustrophobic or unable to go on MRIs, and then we are not able to enroll in the trial, and then we kind of make some of those decisions. What about, maybe next I'll go to Mr. Harder. What about side effects of medications as you were transitioning through different medications? Do you remember many side effects that you experienced? I know you had a severe course, and some of it you don't remember all of the details, but fill us in on anything that you've noticed, or has it gone okay for you?
Everything has gone okay, pretty much. I took IVIG for quite a while, and then I had a reaction to that. So then we changed that. I went with a high dose of steroids, and that was, I didn't really have any problems with that, I guess, other than can't sleep and stuck to the ceiling. But
Okay.
other than that,
Okay. Yeah.
other than that, that
It
was
was okay.
yeah.
Yeah, the steroids are kind of it's a double-edged sword because they affect people a lot for those few days, but the short courses certainly can really help us manage those acute issues and acute attacks. Okay, maybe next I go to Brody. Maybe you could mention, as a child who's developed MOGAD, how has it impacted your lifestyle or quality of life, these treatments?
So these treatments have impacted my quality of life because it's kind of hard keeping up with school, especially now that I'm in high school compared to middle school and elementary school. And missing school is hard because I got to make up all that work, but thankfully I have a 504 plan. Okay. Man, my handwriting sucks. Horrible veins. I have pretty bad veins. They caused me to get a port, which kind of limits what I can do physically, like make sure I don't get a hit.
Great point. Yeah.
Monthly treatments is kind of hard to like keep up with my friends and trying to manage being a kid still.
Yeah.
And then, but having a positive outlook on everything is pretty important.
Yeah. It is so hard. It can interrupt particularly school-age children and learning, and it can really add an extra burden there for children. So that is a real challenge, and we have to kind of take those into account as physicians when we are deciding on how our treatments and what treatments we'll give. And it can be so challenging. So we really appreciate all the things that you've been through. Okay. What about for those who enrolled in the clinical trial, Mr. Van Roy, thoughts on your decision? What helped you decide to be involved in the trial?
Yeah. Thank you. I think the decision was actually kind of a no-brainer. I was just diagnosed with MOG on a Thursday, I think it was, and got to see you on a Monday and talk about possible joining the trial, and there's no approved drug, so why not try a trial to see if there's a way to stop the recurrence, because I did have 2 attacks.
Yeah, and I think it's a great point, and people who have really decided to go that approach is going to help so much for the future. And I think we don't know with some of the other medications, we don't know how effective they are. And in the trial, as was mentioned earlier, people are monitored very closely. And then after one attack, everybody will get the medication. And even if the trial finishes, then everybody will transition to the medication. So, so the hope is that, that these medications will work. And
It's also a free MRI with your.
It's true. Yes. Yeah. Yes. Yeah. So there are some benefits with the trial. What about, Ms. Ricken, do you want to talk about what persuaded you to join the trial?
Sure. I wanted to join a trial because the treatments that I had, which were being on the acute treatment, which was the intravenous steroids, I had a severe allergic reaction going off of it. So that I knew wasn't something that I wanted to do long term. And the IVIG was, while it kept me from relapsing, I was still extremely exhausted. I would get up at 10 o'clock in the morning and want to go back to bed at noon. So I wanted to try something different and hope that I could also be part of the solution to finding a treatment for many of the young people that suffer with this. I felt really fortunate that this struck me at an age where I had already retired, so I didn't have to worry about working. I didn't have to worry about taking care of small children. So I think.
And any downsides you think to the trial, or were the things that you were worried about that you had?
No downsides. The downsides that I with the previous treatments were, as someone else mentioned, was bad veins. I have deep, slippery veins, and I don't have to deal with that now on the trial. I think probably the only downside would be travel time, and that's pretty minor.
Okay, yeah, and I think we've really appreciated the support of the pharmaceutical companies to help with travel. You know, we've had people from as far as Oklahoma come into our trial, and it's only possible because of that home dosing and some of those other aspects. So we've really appreciated all of that. What about non-medications, Ms. Kraft? Any thoughts on non-medication approaches that you found helpful? Or diet changes, any other things that you...
Yeah, I think when I was trying to figure out, I think anybody with MOG, there's pain associated with it. I had leg pain, still have leg pain, but originally I was thinking physical therapy. We thought that would help, but that didn't really help me. But someone recommended dry needling or acupuncture, and I wasn't real fond of it at first, but my brother-in-law was going to acupuncture, and it really had helped him with, he had Lone Star tick disease, so he couldn't eat red meat, and he really wanted to eat a steak, so he was willing to do whatever. And so he was seeing someone, and I decided, why not try? Why not just give it a try? And I will say, for the time that I was able to do it, 6 to 8 months, that was something that I found very helpful for the leg and back pain. Of course, there definitely has been a change in diet. I don't drink sodas or things like that, but that's really just so that I can feel, I don't know that it helps MOG, but I feel better.
Understand.
Yeah, I feel better.
And I think as physicians, we're open to people trying things, particularly, exercise, yoga, all those things are really good for your general health and your mental health. And we've heard a lot about the mental health challenges of having some of these conditions. So certainly, I think being open to some of those approaches is really important. Yeah, so great to hear your perspective there. Maybe, Brody, I'll just ask, hopes for the future. We've heard of a lot of advances in the field of MOG. You have any thoughts on that?
Well, obviously a cure, which might not be possible, but still. I hope I get in the clinical trial. Give me a sec.
And I know you said your writing was bad, but don't worry, all the doctors' handwriting is worse. So I'll guarantee you that. So maybe you could be a good doctor.
Well, it fit right in with this handwriting. Treatment more manageable with less side effects and time commitment. And for others, I would say more awareness, because it took me 5 months to get diagnosed, and some people get misdiagnosed, and for some it takes years to get diagnosed. And I would say more autoimmune research.
Yeah, that's brilliant and a great point. And I think we'll give a round of applause. What a hero here on the panel with these older adults.
I get that a lot.
Mr. Harder, any thoughts on advice you would give clinicians or researchers about what matters most to patients during treatments?
I don't know. As far as treatments go, I haven't had really any bad experiences with any of the treatments. A lot of the stuff happened when I was sleeping or whatever. I was in Rochester for 58 days and I slept for 26 of them. Mm-hmm. So a lot of it I don't remember.
And I think I know you had a hard time with us getting your disease under control.
Yeah.
So getting an effective medication.
Being that
probably,
it was two things, I had cancer and then I had the MOG on top of it. So they were fighting each other and trying to get something to work for both was probably the hardest.
Yeah.
But you guys figured it out.
Yeah. And Dr. Syke Mazurek, has been a great doctor for Mr. Harder over many years. So
Very good.
great. And maybe I'll leave with final thoughts from each person. Maybe a couple of words just on what matters most for patients and what should we be thinking about and the community and as physicians treating MOGAD patients in terms of treatment. So a couple of thoughts, maybe quick thoughts across the group, and then we can wrap up.
I think kind of what I alluded to earlier, just feeling seen and heard as an individual patient. Before I came to the Mayo Clinic, I did not get that with the medical care. And so I felt, my husband and I were talking about it last night, I remember crying just with such gratitude, like somebody's actually listening to every little thing and not saying, that's not happening to you. And so I think just gratitude for being seen and heard and listened to, and not just being a number, but really being Melody Craft, the patient. And I think just that is so important.
Yeah, absolutely. Agree completely. Yeah. So, and we're lucky at the Mayo Clinic. We have a little bit more time to see patients sometimes, and that gives us the time to listen. And then we do work collaboratively across all the departments. So we have many people who will listen and will kind of, Okay. Ms. Ricken, go.
I would say listening, believing, and empathy.
I would have to echo that thought exactly. My team listened to everything I had to say, so.
I would also say the importance of having an advocate with you. So if there's another person that can come with you, because the directions sometimes come so quick, remembering, and for me, I have a hard time remembering them. So having someone else in the room to kind of capture some of that, and then the wonderful notes that we get in our patient files is super helpful.
Yeah, and I think that's true. I think many of our MOG patients, if we don't have somebody there, we should have somebody on the phone. And sometimes people find it helpful to record the conversation, and we're always open to that to try and help people remember what's going on. And then using the online portal to communicate can be helpful.
Very helpful.
And then I'll echo what Melody said, just that for doctors to hear us as individuals, that every person's journey is a little bit different, even though we have the same disease. We're in different stages of our lives. And then to keep researching and fighting for us the way y'all have been and giving of your time, it's extremely emotional to just have y'all here doing what you do for us.
Yeah. No, thanks for shedding a light on all this. It's so important. Yeah, absolutely.
I would say doctors that are up to date with patients' treatments and doctors that offer pre-treatment for side effects and treatment for side effects.
Great. That's a great summary. So I think we'll stop there, and I'd like to thank all of our patients here who've participated. So maybe a big round of applause for everybody. Thank you so much.